name is Lesley Wattsman and I'm 68 years of age. I moved into my present flat in 91. I was a very healthy person until around about 40, and then one day I came home and I really couldn't breathe and I needed to go to King's, and they diagnosed me with asthma. Then around about 2009, I thought that I actually had allergies, and I went to see my doctor and asked for some antihistamine tablets, and he looked at me and he said, "I don't think you really need those." He said, "I think there's something else." He said, "But I'll give you them if you like, but I'd like you to go for a blood test." And it was at that time that I was diagnosed with rheumatoid arthritis. And then I suppose it was a year or so ago, the doctor said to me that I was pre-diabetic and that I really did need to start looking after myself. I've lost weight and I don't take medication. My sugars are still a little high, but I don't need to take medication for it. About 18 months ago, maybe slightly more than that, maybe 2 years ago, I got an invitation to go to a meeting about a health and wellbeing plan, and the letter came from my doctors, and to be quite honest, at the time I thought it had come to me because I had complained about how I felt that people were doing things unto me as opposed to doing things with me. So I thought this might be an opportunity to have a voice, really. And I went along to a meeting, and when I got there, a workshop meeting, and when I got there, there must have been about 150 people, and I spent the day and we did lots of workshops, and I spoke to lots and lots of people because I'm just nosy about what other people are and what they do. And it was so exhilarating to actually meet other people that were saying the same thing as me, because I was thinking that I was just becoming a grumpy old woman and that I was, I was just complaining all the time. But it seemed that other people were experiencing the same thing as me. So, and it was really nice on that meeting as well, because I met the people who cared for me, and it was really nice to be able to sit down and say to them, you know, I'm not just a bag of diseases or conditions. I'm actually a human being, a woman who has had a life, and that, you know, I want to be heard. And so I went back to all the other meetings, and gradually, with the help of doctors and other care persons and other people who facilitated those days, we worked together and we created a health and wellbeing plan that was about me, about us, people who had a couple of conditions, many conditions in some cases. And when it was finished, it was the most, I actually had pride in that document, that we had spent that time putting it together. And I was proud of us and proud that we was able to do that. And it really felt enabling and that we had achieved so much. The health assessment plan was done in a very professional way. However, that was much more formal than the nurse that came to my home. And because I had worked with care plans and things like that before, once I had the actual care plan that we'd put together, I was able to look at it. When I had ideas of what I wanted in that plan, I put them down. So when the nurse came here, it was quite easy to put a plan together for me. That plan has made me feel confident to be able to say to people, no, that's not quite how I want it. I would like to have a conversation with you. I don't want you to keep telling me what I need to do. I want to have a conversation about how are we going to try and do that. Because sometimes I feel that I'm talked to, that I'm not asked, I'm just told what to do. And that health and wellbeing plan has given me the courage in a way to talk to my consultants and say, no, I don't think I'm going to do that. I think I would like it like this. I think everybody should have one. I think every single person that I see, because having several different things, I see different people. And so when I go and see those different doctors or those different nurses or those different consultants, every single one I see says, and can you tell me? Where if they actually looked at my health and wellbeing plan, they would know. They would know. They wouldn't have to keep asking me, what's this, what's that, what's the other? My experience of the health and wellbeing plan has been a bit checkered, really. I've actually got one. I've got a copy of it here. I carry it with me to every appointment that I go to. What has been disappointing is that I haven't been able to give them to everybody that sees me. In actual fact, one of my consultants actually refused to take it. My dentist said he didn't think it was any use to him. And my podiatrist is the only person that's actually put one on his file because he feels it's useful for him, because he can have a look at that and see where things are at. I think there needs to be some more advertising or some more training about the health and wellbeing plan. There needs to be some training, especially for some staff, on how to speak to people in an open conversation, as opposed to speaking to you in a this is what you must do. That I understand that medical staff are there, and I say this from a good place, not in a bad place, but I think all their training is trained them to tell people what they need to do. You need to take this medicine, you need to keep that clean, you need to lose weight, you need to. But I feel we need to start saying, how do you think we can do that? Or what do you think would be best for you? And that they would get more out of me as a patient if they use that open language than they do telling me what I need to do, because I feel I don't need to do anything. I can do whatever I like. Having said all of that about the care coordination development process and the health and wellbeing plan, I do come from a benevolent place, and that I do understand that change is very difficult and that it takes time for people to change how they work. I do understand that for very busy health professionals, another form feels like another burden. But I do believe this form, once people have got used to using it and have got used to having a conversation with their patients to fill it in, it will become a really good tool for healthcare workers, doctors, nurses, anybody who is visiting people on a regular basis and are moving from one patient to another that they don't know. And I really do believe that this is something that we really should work towards in all areas of care.